Welcome to today's podcast. I'm Dave Butler, and today I'm going to talk to Brad Eldredge. He is a fantastic physical therapist that's here at our clinic. He specializes in scoliosis and is certified in the Schroth Method, and he's been a great addition to Align Therapy. He was trained about 9 months ago, and I wanted to talk to him and get his thoughts on over the last 9 months what he has noticed with treating scoliosis and the benefits and the frustrations and things like that, because I've been doing this for a long time and I wanted to get his take on training for scoliosis treatment in the Schroth Method, as well as how he's been noticing things going with treating thus far for the last 9 months the scoliosis patients. So we go into tips that he has for scoliosis patients to help get the best results possible with treatment. We go into his background and how he got interested in scoliosis treatment as well as physical therapy. And we go into training and what training was like, and over the last 9 months, what life is like at Align Therapy and how he's been treating patients. So there are a lot of good nuggets of information in this podcast episode. Hopefully you enjoy it, and hopefully you get to know Brad a little bit better. He's a great therapist. I'm so glad we brought him onto our team. So here's Brad. Welcome to today's podcast. I'm sitting here with Brad Eldredge. He's one of our amazing scoliosis specialist therapists, and we're going to talk about his experience with physical therapy and scoliosis, his background. He got trained. How long ago was it that you got trained?
In scoliosis specifically? Yeah. Back in April.
In April.
Yeah,
So
April I went out to get my training.
So we've been about 9, almost 10 months since Brad's been trained in the Schroth Method specifically. So I think he has kind of updated knowledge on the training, as well as the last 9 to 10 months he's been working with scoliosis patients. And I want to get his insights on what he's seeing, because I'm old at this. You know, I've been doing this for 10, almost 11 years now, and I want to get Brad's take on that. But I also wanted to introduce Brad because he's an awesome therapist. Patients love him, and we're really lucky to have him here. So, Brad, kind of give us your background. What's your background as a PT?
Yeah, so I graduated December of 2023, and then really reached out to you guys. I'm sure we'll kind of go into a little bit of the background of what led me here, but reached out to you guys, started my training pretty much before I came into the PT office. I got to go out into Denver to get my training. And started here. This is my first job, and I've been loving it. I don't plan on really moving from it as far as the future goes. I've really loved this. I've always wanted to do PT. Pretty much I would say since right after high school with my own injuries, kind of how a lot of other PTs kind of find their way into this in this profession.
That's what I did.
Yeah, an injury led me to a PT. I really enjoyed what he did, and so stuck with it. I always knew I wanted to do something like orthopedic related. You know, I prefer the outpatient setting, and so found this place through obviously one of my rotations, and didn't know that I was going to get into scoliosis. So to say, but here we are, and I love it. So
I don't know that any of us in the clinic actually knew we were going to do scoliosis, right?
No, definitely not.
Kind of piqued our interest and things like that. But it's good to hear that you're planning on sticking around a while.
Oh, yeah.
Because we got big plans for Brad. So you went through school. Kind of tell us how you started getting interested in scoliosis. I mean, if we think about general physical therapy, they don't really touch on scoliosis in school that much. So that's probably not where it happened. And most PTs don't really love treating the spine, let alone spinal deformities.
Yeah.
So how did that happen?
Yeah, like you said, I think during PT school, we went over maybe 1 or 2 days of like a presentation of scoliosis, really to just say, hey, this is a thing. How does it present a little bit? And maybe ideas of how you can treat like some muscle imbalances, strengthening, things like that.
Were they still discussing the stretch the concavity, strengthen the convexity?
100%. That was pretty much all to the extent of it, right?
And we still see that all the time.
Yeah.
Like Yeah. We don't use that all the time, but we see that all the time.
Yeah. So really didn't, like you said, get it through school. It was actually my first rotation where I went out for a 12-week rotation after we had been done with our coursework. This was my very first rotation. I got Align therapy. All of a sudden I was looking into it and I saw spine, I saw scoliosis specialties, and I'll be honest, I panicked. Like I think maybe like a lot of PTs, like the back there's a lot that can happen with the back and spine. Maybe a little fearful of it. And so yeah, coming into this clinic, that was pretty much the thought is more fear than anything.
Right.
I think the first couple of weeks here in the clinic, I obviously had no idea what was going on. The Schroth treatment that we do is something that I've never had even heard about in school. And so it took a couple of weeks, but slowly I feel like I felt more comfortable with it. I really enjoyed the patient population that was coming in. Like that was just something. I'm the oldest of 7 kids. I'm used to,
right,
being with a younger population. I don't know. I feel like a lot of my interests lined up with that, and I was finding that over the rotation that not only was I enjoying and being more comfortable with the spine, but again, I think the patient population was huge for me. And by the time I had finished or was getting towards the last little bit of this rotation, even though it was my first rotation, I remember talking with you and Corey, if you guys remember, and being like, look, if it works out, I was like, this is something that I'd be very interested in. And so, yeah, I went and finished a few other rotations over the next year. And after those rotations just confirmed to me that I enjoyed this clinic.
Why is that, by the way?
I have come to realize that I think it is because in this clinic, I saw you and Corey enjoy what you guys do. I had seen the research actually back up the Schroth Method. And so I felt like every day that I was coming to PT and I was providing this treatment towards patients, it was something that was backed. It was something that we believed in. Yeah. It was almost fresh each time. And so there wasn't like a redundancy. It didn't feel mundane. And then we can also get into maybe on another day of the whole insurance side, right? That we can get into. But yeah, I just felt like there was a passion coming from you and Corey as PTs that maybe I didn't see in other PT clinics. A lot more burnout compared to what Corey's been for 5 years. You've been for 10 to 15 years, right? And seeing that there's not a burnout with that, like that was huge for me. And that was a worry in PT is that, hey, it can get redundant and the same thing. Right. And so yeah, by the end of those clinicals, it just confirmed to me like this is what I wanted to do. And so yeah, reached back out to you guys, and it worked out with some therapists having some babies, and here we are.
We're glad it worked out.
Yeah.
I mean, the timing literally couldn't have been more perfect, actually.
Yeah. It was meant to be.
It was meant to be. The stars aligned and Brad is here. So that journey is what, if we think about how we treat scoliosis and we think about the passion that we have for it and really wanting to treat these patients the best that we can, it's a different level of treatment.
Yeah.
It's a different level of engagement. And I think that's really, for the right therapist, it's a great fit.
Yeah. It's very self-fulfilling. And it's, like I said, it's something that we get to help people with, a diagnosis that's scary, a diagnosis that's lifelong. And to be able to give them something, to give them hope, that ultimately is, I think, is what drew me to this clinic and treating scoliosis specifically.
Yeah, as fun as an ACL or knee replacement is, it's not really a lifelong treatment. It's not as scary. It can be scary, but it's not. It's a different kind of scary.
Yeah.
So that's cool. So what has your experience been now that you've been treating patients in the clinic, treating scoliosis? I mean, what % of your patients do you think are scoliosis at this point? Or scoliosis, kyphosis, spinal deformities?
60 to 70% probably in my current caseload.
Right.
Yeah, I'd say at least 60% of the day.
So as far as spinal deformities, it's pretty much every day
Yeah.
that you're seeing something.
Yeah.
How has that been over the last 9 months? How has it been getting into, let's go into training after that, but just getting into treating patients?
Yeah, I think over the last 9 months, some things that I've realized is every case is unique. You know, we can have patients come in maybe with a similar curve pattern,
Yeah.
but everyone's presentation is unique. It's different, very individualized. I think that's probably the biggest thing that I've noticed. A couple other things are family involvement. I think something that I've noticed is with different patients coming in, you can tell when the family, a mom, a dad, brothers and sisters, when they're involved with the plan of care, it makes it that much easier on the patient who is diagnosed with scoliosis. Having that support is huge. I think it plays into having the patients doing their exercises at home, which is a big thing for us here with the Schroth Method. Just having that family involvement and support is massive. And you can tell a difference in patients, their plan of care, how they respond, their motivation. It's pretty apparent over the last 9 months for me.
The variability of that, I think it is an eye-opening thing to see. You know, you might have two 25-degree curves that may be in the same place, maybe a little different ages, but they're completely different.
Yeah.
I mean, I think you've actually seen a set of twins.
Yeah.
And they're different.
Completely different.
Same genetics,
different curves.
Different curves.
Different tension, different pain.
Yeah.
Yeah.
So,
which makes it fun for us as therapists also, though. I think that I think that variability is again what makes treating scoliosis a little bit unique and difficult at times. I won't say it's always a good thing. It makes it difficult at times too, right? Because there's so much variability.
Yeah, definitely. I think, you know, we have a lot more variables with the family, the motivation, the age of the child, you know, complex spine issues. And as a PT, we actually, I think, really enjoy that. That's why we get into it, because we like being challenged. Not that we want our patients to be challenged and have severe things, but those are out there anyway. You know, we don't wish that on anybody, but it can really limit the burnout risk, I think, as far as physical therapists go, finding something that you're passionate about.
100%.
So tell us about your training. You did training 9 months ago. So in April, how was that?
Yeah. So I went to Denver. I trained with SSOL. You know, we went out there for a week. Well, I'll back up. Even before we went out there, you know, they had a whole like preset of videos, you know.
Pretty intense.
It was like 24 hours worth of videos, but I think it was awesome. It set the ground rule of, you know, it explained the history of the Schroth Method. It dove into, you know, scoliosis and how that presents, how it's, you know, a three-dimensional issue. Just all of the basics that once we were able to go out there, it was just hands-on. It was, you know, learning the Schroth Method on having patients coming in to the actual clinic that we were at, as well as working with other therapists who were, you know, also getting trained at the time. So we went out there with all of that background information first, and then, you know, 6 days, 10-hour days. It was
sort of long days.
Yeah, it was rigorous, but again, I think, you know, the Schroth Method is a very disciplined, very exact approach, right? We're trying to get these patients into perfect postures and do a very specific breathing pattern. And so I think that repetitiveness, and I think there's a need for it to be that long. And so, you know, it's one of two courses, right? So we'll go back out and kind of finish that. I think next year is when we'll head out to the second course. But yeah, it was good. It was nice to have that done before I started PT, like before I actually started working here as well.
Right.
Like I think that was nice too, is I was able to come back and immediately utilize what I had learned there and treat patients. I think I came back in the first week, I had 5 or 6 patients day one who were scoliosis.
That's awesome.
And so it was nice to be able to just utilize and apply that to my day-to-day.
So you were a student with us.
Yeah.
And you weren't trained in Schroth at the time you were a student. Did the course kind of fill in the gaps? Was it like, oh, this is why we do this? Corey was great at explaining things and guiding you through that, but
Corey definitely did do awesome. He gave me a lot of background, had me read a lot of the the book list, the pamphlets and stuff. But I think going and actually, believe it or not, the pre videos that we had to go through, those were almost like, those were equally as beneficial to me to understand the why. Why are we doing this method?
Yeah.
Why are we placing the position, in this position with this traction, or breathing into this concavity or this area of the body? So I think the why came a lot from that, and then it was supplemented by going out and actually just practicing. So I think it filled in the gaps for sure.
Right. So let's get into, let's see, someone's just diagnosed with scoliosis. What advice would you give them, knowing what you know now, to navigate that diagnosis better?
Well, like I said earlier, you get that initial diagnosis, and rightfully so, I think most people's reaction is, holy cow, it's a scary diagnosis, right? You're realizing it's a lifelong diagnosis, and so I think there's a lot of fear that comes with it. Mm-hmm. So, I think my advice would be, one, realize that there are things that we can do, and to try to calm down those nerves of the unknown. What does this look like for my child or for myself for the future? So getting that, or having that realization of hey, there is something that we can do. And then I would say just be an advocate for yourself. I think a lot of the times with scoliosis in the past, it's kind of just you go to your pediatrician, you go to your doctor, you get this diagnosis, and then it's okay, now what? And a lot of times the education is, hey, we're just going to observe and kind of just wait and see if the curve wants to progress, worsen. And so I think being a self-advocate for yourself is huge with this type of diagnosis. And then, again, realizing that there are things to do. Coming and doing the Schroth Method is huge. Finding out if, hey, am I a candidate to get bracing right away? And so I don't think you always have to just sit back and observe. I think there's things you can do, and that would be my biggest advice: is advocate for yourself and take action.
Yeah, and it sounds like educating yourself on what options there are, which is kind of hard because sometimes you go online and you look at there are some wacky things out there for scoliosis, unfortunately.
Yeah.
But yeah, if you educate yourself in a good way based on what's actually in the research and supported, then you can advocate for yourself better.
Yeah.
Then you can get the treatment that actually works. And then you would be more consistent with that treatment because you've educated yourself. So I think it comes full circle with that.
Yeah.
So that brings me to another question. What are the biggest issues that you see in how scoliosis is treated currently? I mean, that kind of a loaded question. What are we seeing as we see patients that are frustrating or that you see could be changed for the better?
Yeah, just to play off what we were just talking about, that lack of education, I think, is one of the more frustrating things. Patients not knowing where to go, being told to just sit and wait, a lack of education of what even is scoliosis. We have patients who will come in and, hey, I have this diagnosis, but what does this mean? What's scoliosis? And so I think just getting the proper education, or I guess the lack of proper education is a frustration of mine.
Yeah.
And then not being directed appropriately. And I think that's a big thing that we're trying to push I know you've been a big advocate of this for years, and we're continuing to try to do it even more so, but trying to push that knowledge and to get, referrals from doctors to a place where they can actually come in and do physical therapy, which is research backed and shows benefits, versus just, hey, let's sit and wait.
Yeah.
And if we need to, we'll get to a point of bracing when we approach that. But it's like, what happens before that time?
Right.
And I think that goes into help easing some of the concerns from patients' parents and family members.
And I think sometimes the wait and see approach, what we call the wait and see approach, let's wait and see if it gets worse. Let's wait and see if it's progressing, and then we'll do something. I think providers are well intentioned with that.
Yeah.
Because they are not wanting to overtreat, or maybe they don't even know what to do until it gets to the point of bracing or surgery. But if I was a parent with a child with scoliosis, that would kind of freak me out.
Yeah.
Like, oh, let's wait and see if this gets worse. It's like, so we have no control over this? I guess we're just going to wait and see what happens.
Yeah.
When truly, like you said, there are research-backed things that can be done. And so if we can get to those things and not just wait and see, I think mentally it's a huge benefit to our patients.
I would say arguably one of the biggest benefits, right, is to make them feel like they have some sort of control with it, which I think is hard with scoliosis.
Yeah, they feel powerless.
Yeah.
They feel like, okay, this diagnosis happened to me and I have no control over this. So giving them the reins is helpful. Any other issues that you see? You kind of touched on referrals a little bit.
Yeah, I think this is something that we're trying to do of going out and reaching to pediatricians and to surgeon offices, to get those referrals. And I think we're still not where I would love it. There's a couple surgeons who are awesome at it, maybe some who, and it might just not be really knowing where to refer people to, right? And so I think the lack of referrals after you have a consultation or a meeting with a surgeon or a pediatrician is another frustration, another area that I would like to see us as a healthcare profession better at.
Yeah, and I think getting the word out with podcasts like this, videos, going to talk to them, we're trying to build that multidisciplinary approach where we're all on the same page and we're all trying to help each other out. And I think that's been a struggle, and I don't know exactly why that is, but yeah, I think we're making some headway, thankfully. So have you, if we go back to like the multidisciplinary approach of how scoliosis, in my opinion, should be treated, have you seen some successes with that? Have you seen some failures with that?
Yeah, I think a big success that we have is, working with Adam Wall with some bracing, right? We have a very good relationship with him. He's comes into the clinic. He does, comes in, he'll adjust a brace. He'll help us kind of get an idea of if a brace is fitting well. So I think that's a success. I think with, Dr. Spears, you and him have a really good personal relationship as well, where you're talking about a patient who you guys are both working with, and it's like, hey, how can we do this together to better this patient or to give this patient the best care that they can get. So I think those are some successes that we have here in the clinic.
I'd love to see it increase, though. I'd love to see it where, we're all on the same page. We're all directing patients in the same way. They're not getting lost in the cracks, stuff like that. But it takes some time. It takes some education. So I think it kind of goes back to your comment about we need more education. We might just not need education only for the patients and their parents, but for the providers as well.
100%. Well, I mean, again, even in PT school, no knocks at PT school, but we don't get taught this stuff in PT school.
Right.
They may mention, hey, Schroth is an option at this point, but
other than that,
that's pretty much it. And then you leave PT and most people still don't feel comfortable or want to do it.
Right. And I think if you're a physical therapist listening to this podcast or watching us, I think the takeaway is know where your limit is. If if you're seeing a 13-year-old who has progressive scoliosis, recognize that core strengthening is not the answer. Yeah. Recognize that there is something better that you can do. And that's where referrals come in. I don't like treating pelvic floor problems. I have therapists that I refer out to for that. Yeah. And I think in physical therapy, we try to be specialists in everything. Well, not specialists. We're generalists treating everything. And we lose a little bit of the ability to see when a referral is to be sent out. Yeah. And I think that's something that our profession can do better. Yeah. Is not trying to Google it and figure out how to treat it. Sure. Send it to somebody who knows what they're doing. Yeah. Especially when, Schroth takes a significant amount of training, and we can't just do that over Google as much as we'd like. So what are some quick tips that we already talked a little bit about, suggestions if someone's newly diagnosed with scoliosis, but some quick tips on what you suggest for somebody who's watching this that might have scoliosis.
Yeah, I agree. I think we've touched on a lot of them that I would say, but one quick tips: stay active. Realize that, hey, this doesn't control me, right? This doesn't have to dictate your life. Stay active. Multitude of activities, sports, outdoors, hiking, things like that. Again, advocate for yourselves. Go and seek care. Come and see us. Come and see me. But I think just taking action is got to be probably my biggest thing. Like that I would say is don't feel like you can't do anything. Take action. Breathe. Realize that there are things that we can do. I think I'll be repeating myself if I say other things, but that's what I'd say. Yeah. What about you?
Oh, all right.
Yeah, I'll turn
I'll
turn it back on you.
So my tips go along the same way as educate yourself, and taking action, I think, is key. Like with anything, if you can research what's going on, take the reins of your own health care as much as possible. This isn't just for scoliosis that I'm talking about either. This is, if you have diabetes, take the reins of your care. Your physicians and your PTs and other healthcare providers are there to help you get to your goals, but you also need to be a part of that. And if you're just passively letting it happen, you probably won't be getting the best care that you could be if you were involved in that. I have a lot of soapboxes, a lot of pet peeves, a lot of things like that. But that's kind of the big thing. We're trying to change in Utah. We're trying to change how we work together as in the different disciplines, the surgeons, the orthotists, the PTs, the pediatricians. I want to make that something that we're all on the same page. It's a big ask. Utah has 3 million people now, so we have a lot of providers, a lot of people who could benefit from those services. But that's kind of my tips. Awesome. Take the reins. Take action and take the reins for your healthcare. I think is a good takeaway for that. So, any parting comments, Brad? Any thoughts that you have?
No, other than I appreciate you bringing me on, earlier last year, and I love treating scoliosis. Like I said, I love our patient population. I love giving hope and maybe guiding for patients who may be lacking that. I love doing what I'm doing. I appreciate you having me on and being able to talk about it.
Yeah, I'm glad we finally got you on a podcast.
Yeah, been a minute. Long time coming.
Right. Thanks, Brad.
Yeah, of course.